We have come to the second part of the inaugural of second day of APAC India Digital Empowerment Meet and Awards. And now we have with us eminent healthcare leaders, I must say hospital administrators and leaders with us. We have with us Dr. K. Hari Prasad, President, Hospital Division, Apollo Hospitals. We welcome Dr. K. Hari Prasad. Thanks so much for joining us today. We have with us Dr. Alok Roy, Chairman and Managing Director, Medica Super Speciality Hospital. We welcome Dr. Alok Roy. Thank you so much for joining us today. We're also joined by Abrarali Dalal, CEO Sahyadri Hospitals. We welcome Mr. Dalal. Thank you so much for joining us today.
Thank you.
With this, let me have a perspective from Dr. Alok Roy, Chairman and Managing Director, Medica Super Speciality Hospital. The name of this session is Building Digital Infrastructure for a Better and Connected Healthcare System. My question to Dr. Alok Roy will be, how do you see when we say that need of the hour is upgrading digital infrastructure and ensuring connected healthcare, especially in the new world order? Your take on that, Dr. Alok Roy.
Thank you, Mr. Goswami, first of all, for allowing me to be part of this seminar. And today you can't think of world without digital connectivity. It not only brings the comfort, the ease of working, it also ensures seamless connectivity. Like to give you a small example, you require digitalization at every level, pre-hospital level, and post-hospital level. In pre-hospital level, inquiring, booking your appointments, seeking doctor's availability, seeking dates for admission or surgical can be done by sitting at home. While you are in the hospital, all different processes, if they're interlinked, then for a doctor to assess you, it digitally becomes much easier. Earlier, every doctor had to visit a patient. Today, especially this pandemic has taught us that everyone need not visit a patient or be at his bedside, but the patient get the benefit of the consultation of the specialist not only in the hospital, but across the globe. So within the hospital, he has that comfort, and beyond the hospital, again, he can get a test done and report can be loaded on his smartphone or whichever method he uses. So digital is not just a requirement, it's a way of life. It is embedded in our DNA now. And as the time will progress, more and more digitization would bring more and more of comfort, ease, bring the cost down, and connect the entire world together. And patient can be anywhere in the world, but can consult from doctor anywhere. Many of us are running such schemes across the country where doctors are available on call, on digital call. So digital is not that what it can do, what more it can do. It's embedded in our DNA now, Mr. Goswami. Thank you.
Right. I know Dr. Alok Roy has to leave for some urgent meeting. So before he leaves, I'll ask another question to you. And when we talk about making digital infrastructure robust and resilient, what are the challenges and how can we overcome those challenges? Your take on that, Dr. Roy.
Actually, the digital, every country, every person must have the benefit of digitization. The problem, the biggest hurdle in digitization across the country is the kind of revenue streams we have, the kind of affordability hospitals have, the kind of extra money they have. So people, when they have to invest, they invest first on doctors, then on equipments, and digital becomes the last. If we have a digital process and systems available with us are a little less expensive, or the way, if you just compare how much it costs to get an MRI done in USA and how much gets done in India, you'll realize that sometimes it is as low as probably 10% of the cost what is in US. So they have access to a lot of funds which they can put in digitization, which is not available in India, which is not available in third world countries. As a result, the digital growth is being wanted, but is not being implemented. So we are looking for cheaper solutions, we are looking for easier solutions, which will come. One thing we have seen in life, especially with digital and the computerization, that things have become much cheaper than what it was earlier. And the processes have become faster and the devices have become smaller. So hopefully once that the price points are countered, then there'll be more digitalization. As you remember that the maximum number of cell phones are in India. We have crossed the maximum number of people having phones is far more than any other country in the world. So it shows that once the prices are brought down, its effect will be held by more people and its effect will be more pervasive. That's a one huge uh, obstacle in our path of growth in digital world.
Right, right. Quite interesting and very important point raised by Dr. Alok Roy. I know you have to leave, but before you leave, we have a small token of appreciation for you, a certificate for you for being part of this conference. Can we have the certificate on screen, please? The certificate of appreciation is given to Dr. Alok Roy, Chairman and Managing Director of Medica Super Specialty Hospitals, for his dedicated efforts and exemplary work in healthcare. Thank you so much for joining us today in the inaugural of APAC India Digital Meet and Awards, the
Thank
healthcare
you.
track. Thank you so much, Dr.
Thank you.
Roy, for joining us today. And this
Thank you.
certificate will be made.
My apologies for leaving it early, but I have to leave for family function.
We
Thank you, sir.
understand.
Thank you.
Not an issue,
Thank
sir.
you.
With this,
Thank you. Thank
let's
you.
have a perspective from Dr. K. Hari Prasad, President, Hospital Division, Apollo Hospitals. Dr. Prasad, what's your take on that need of the hour for upgrading digital infrastructure and ensuring connected healthcare? If you can unmute your mic, please. Yeah,
It
yeah,
is unmuted.
yeah.
Any solution we talk about needs to address the challenges that are faced by the community. So at this point of time, I guess the challenges are very much that are very much relevant are access, affordability, appropriateness of care and accuracy of care, accountability and standardization of care, and the use of artificial intelligence and big data and analytics. Now you would see the common thread between all these five is the A: access, affordable, accountable, appropriate, accurate, and artificial intelligence. Now for these are the challenges, and in these lie the solutions. To be able to reach the solutions, the common thing which is essential and which makes these solutions possible is digitization. And we just cannot talk about digitization unless we are connected. The last mile connectivity is the most critical component of digitization and also healthcare in this part of the world. Unfortunately, major part of the world is not connected. We all talk about mobile phones being there and large number of mobile phones and stuff like that. But we did a recent survey with both in urban and in rural areas amongst diabetics. These are the guys who most often need a regular medical consultation or a medical checkup and also would need monthly drugs. And we know that there are plenty of online pharmacy stores available today, and we know that teleconsults have become more popular today. And believe me, in urban areas, more than 70% of these people whom we, were part of the survey, used Amazon at some point or the other. But less than 20% of them actually used the network to buy medications, and less than 5% actually used it for a teleconsult in an urban setting. Now, when you go to the rural setting, 20% used Amazon to buy something, less than 2% used it to buy medications or any stuff, and the concept of teleconsult was not existent. So that's the huge digital divide that exists in the country. And unless we bridge this digital divide, we are not going to reap the harvest of the benefits of digitization. So I strongly believe that digitization is dependent heavily on connectivity. and connectivity across the country and reaching the last mile. And this has to be done by all the stakeholders. The government has to be a part of this entire thing, connecting the country, every nook and corner. Then the private sector needs to get its own act together by getting all its processes digitized, getting the PHR online, and making the patient's data available in a secure format to the patient, irrespective of where in the world the patient is, and then running its processes and systems on the digital platforms and being available to a patient anywhere in the world on the digital platform. And similarly, the community also needs to benefit from this digital platform. But all this is only possible when we bridge the digital divide that exists in the country.
Right, right. I'll come to Mr. Abrarali, but before that, I'll take one more perspective from Dr. Hariprasad. But do you think that you talked about the challenges of access, affordability, accurateness, AI, and big data, also the digital divide still persisting in some cases? Do you think that COVID has changed all these things to a certain extent? Maybe in the last 1.5 years, some progress has been made when we talk about building this robust infrastructure, especially digital infrastructure.
Well, COVID has definitely changed many things, and this happens to be one of it. But a simple example is we have at Apollo has the largest telemedicine network for a long period of time. We inaugurated our telemedicine network about 25 years ago, and we were averaging about 100 to 150 teleconsults a day before the pandemic struck us. Today, we are averaging about 5 to 6,000 teleconsults a day. So that's the change which has been brought about by the pandemic. But I don't think that is enough. It cannot be that it is only a tip of the iceberg. It is only a very, very, very small proportion of the population which is using the system to reach out to the healthcare and which is using the digital network that is available to reach out to either their doctors, their hospitals, or for the medicines. But I think there is a significant thrust which the pandemic has brought about, but it is still not enough. And there's a lot more to be done, and a lot more opportunity lies there before we can really say that we live in a world where we are leveraging the digital capabilities.
Right, right. I'll come back to you, Dr. Hariprasad. Before that, let me have a perspective from Mr. Uh, Abrarali Dalal, CEO Sahyadri Hospitals. Mr. Dalal, your take on when we talk about upgrading digital infrastructure, ensuring connected healthcare, especially keeping in mind the realities of new world order and the future times which is going to come. Your take on that?
Yeah, first of all, thanks, Dr. Goswami, for having me here. I
No,
believe I
doctor.
agree.
Without doctor.
Yeah, Mr. Goswami, I'm so sorry. So I hear and agree all the points spoken by Dr. Hari Prasad and Dr. Roy. Uh, so when you look at the need of the hour, I mean, if you look at digitization in healthcare, even before, I'm going to kind of divide it into before and after the pandemic broke out. So before the pandemic broke out, most of we were digitized. So a patient could actually go on the internet, could research a hospital, could then go to an OPD and kind of book a slot for the doctor, book an appointment, pay online. Okay, once he came to the hospital, there's e-medical records which existed. Post discharge, he could pay online. So everything. So we were at a fairly decent stage of digitization. But what happened after even telehealth existed, video consulting existed. But what happened after the pandemic? I think this entire digitization took a momentum, and it became the need of the hour to address certain issues because the patients obviously the access to the hospitals reduced. There was a fear of coming to hospitals because of the pandemic. So I think what happened was that certain points kind of were highlighted post the pandemic. Managing patients remotely in the hospital. So how is digitization going to help in managing patients remotely in the hospital, where human contact can be less? For example, can the doctor access records of the patient, in the ICU or in the ward at home, and then guide the team on the floor what to do. Managing patients at home through digitization, that became need of the hour. So because obviously due to hospitals and beds not being there, or lesser number of beds for COVID patients, and the government asking to manage patients at home. So how did digitization help managing patients at home, managing medical tourism, which kind of reduced to a large extent, managing your marketing. So obviously even marketing costs would went down by digitization, and somehow streamlining patient services. So I think the last few points that I think are the need of the hour for upgrading digital infrastructure, to address these kind of issues. That's what I think.
And when we talk about building a digital infrastructure which is robust and resilient, future ready, because if you talk about the biggest lesson which pandemic has taught us is that we have to make a resilient infrastructure, be it for healthcare, be it for other infrastructure as well. But when we talk about healthcare infrastructure, the need of the hour must be building a robust and resilient IT infrastructure. Where do you
I think
think India lags, or where do you think India has leapfrogged a lot of advancement in recent past?
so. Let me address some basic issues over here. For digitization. For any sort of digitization that you do, I think what is very important is having a very good wireless network. The speed of the wireless network. So when you're going to digitize things more and more, there has to be a certain element of data security. There has to be a comprehensive cyber security assessment which is required. The network infrastructure has to be very, very appropriate in terms of having the correct configurations for computers, laptops, data speed. So these, I think, are very basic challenges which we face. Besides everything else, I think this is basic. So if you're going to go whole blast or whole hog to digitize, the country, I think these basic three things need to be really put in place, which we are lagging behind. Our networks are not very good, so we need to improve network speed, data security, data transfer, and having configuring various equipment to this extent. That's what I think.
Right, right. I know Dr. Hari Prasad has to leave for an urgent meeting, but before he leaves, my question to you will be that, Dr. Prasad, where do you see the future of India's healthcare story going? Because a lot of interesting initiatives have been taken by government, be it National Digital Health Mission and others. In terms of digital infrastructure, digital intervention, where do you see India's health story going? Maybe 1 year down the line or 2 years down the line. Are we in the right track?
I think the future of Indian healthcare or any healthcare system lies in digitization, and there is it's not rocket science to understand that. That's going to be the future. There's absolutely no doubt about it. But to reach there are two very critical things. One, as Dr. Dalal said, is the connectivity issue. Connectivity to the last mile and the quality of connectivity, the bandwidth is of prime importance. And the second one, which is very, very important, is interoperability of the systems. For example, a patient who is there in Sahyadri hospital and gets discharged from there, the data should be available if the patient comes to an Apollo hospital for treatment for his next episode of care. So interoperability of systems, where we live in a connected world, where there is, for the patient, his or her data is seamless, irrespective of where it is, in which hospital, which provider. And actually these two are very, very critical for us to reach a stage where we can say that we are making best use of the digital world and digital healthcare system that is possible. There are islands of excellence in an ocean of inadequacy. That's the best way to put it at this point of time. There are brilliant hospitals which are digitized, which are having electronic medical records. Like we run electronic intensive care units, we run electronic remote emergency services, telemedicine. You name it. You run telepathology, teleradiology. So the multiple things happening. Similarly, just now Dr. Dalal also spoke about what Sahyadri has done on the digital front. So there are islands of excellence, but there is a huge ocean of inadequacy which needs to be addressed. And once this is addressed, I think healthcare would be seen in a different perspective, seen from a different perspective, seen in a different light, and ultimately it's the patient who would benefit the most. And I think that is the basis of any initiative that we take. The patient should be put at the center of everything that we do. And in once we get digitized and leverage all the benefits, I think it's the patient who is going to benefit the most.
Absolutely. Patients should be in the middle of our focus, whatever we do, be it digital infrastructure, upgrade of digital infrastructure, interoperability of systems, data, everything. But the focus should be on patient, and everything can come together to address that. Thank you so much, Dr. K. Hari Prasad, President, Hospital Division, Apollo Hospitals, for joining us today in the inaugural of health track of APAC India Digital Empowerment Media and Awards. But before you leave, we have a small token of appreciation for you in a form of certificate. Can we have that certificate on screen, please? The certificate of appreciation, this certificate is proudly presented to Dr. K. Hari Prasad for dedicated efforts and exemplary work in healthcare. Thank you so much, Dr. Hari Prasad, for joining us today's inaugural. I'll move to Mr. Abrarali, Dalal, CEO, Sahyadri Hospitals, for some more discussions. Dr. Prasad talked about two things primarily. One is interoperability of the process, the system, and also putting patients in center and nothing else. That should be the future of Indian healthcare story. What's your take on that? Do you think that something more should be added to that statement, or do you think that this too should be the most focused area for future?
So again, I am speaking in the context of the pandemic, coming and disrupting our lives, and I think that's where we are also discussing digitization and why we feel that digitization should be taken to a different level. Of course, patient is the center of everything, and everything that we do has to be towards ensuring patient safety, proper treatment for the patient. But I think another thing which is very important is safety of the staff, hospital staff that is going to be looking after the patient. Because if the staff is looked after well and protected, patient care is going to be better. So that's where I spoke about managing patients remotely in a hospital. Currently, if you look at if I talk of COVID wards or suspected COVID wards, every patient now coming in the hospital has elements of suspect that he could be COVID positive, and looking at the way the staff is getting exposed. I think digitization should focus. We should focus ourselves to reduce exposure of the staff. Of course, it is not possible for everyone, but a large chunk can be exposure of a large chunk can be reduced by kind of remotely managing patients in a ward and ICU. It happened before the pandemic as well. But I think it should take, and it will take more impetus now, managing patients at home again. So I think managing remotely, and besides patient, safety of the staff, doctors and nurses who look after the patients, is going to be a very, very important point that has to be taken into account post pandemic era.
When we talk about digital infrastructure, we are talking about a lot of data being consumed and analysis of those data for better outcome, right? But are our hospitals, be it the mid-level, be it the big-level hospitals, are our hospitals ready with that kind of ecosystem where we ensure the security of this data? Because this is an age of data, and how do we secure that data? So are we, as being a CEO of a hospital, what are your thoughts that how your hospital is securing that data, the operative data, and what will be suggestion for others as well?
So I can't really comment on the level of security of other hospitals or other chains. If I make a general statement, I believe that maybe the security is not up to the mark. People have realized that, and I'm sure various hospitals, as we talk, are talking to various other and various other experts who are and trying to kind of strengthen their data security, moving to the cloud system, and just working on it. That's what I think. But of course, that's going to be very important because there's going to be so much data flow in digitization. It's very important that the data is secure. So I'm sure hospitals are working on it. I really can't say that everyone's is perfect, but I'm sure people will be working towards data security at this point of time.
My last question to you will be that when you talk about resilient healthcare infrastructure, especially for hospitals, we talked about safety standards, fire standards, electrical consumption, everything. do you think this pandemic has put for that agenda as well, spotlight that the infrastructure of hospitals in terms of fire safety, electrical engineering, a robust IT system, that also is now the focus area. Maybe in some hospital it was missing till the time pandemic has happened.
See, I'm sure the pandemic has, awoken managements of many hospitals and make them take a relook at all the points you mentioned. And what has happened during the pandemic is that it has hit us so suddenly and without any preparation that hospitals have learned to manage resources more efficiently. So hospitals have learned to do more in with lesser resources, and that has been a great learning for hospitals. And it's actually made hospitals more agile, I think, more efficient. Yeah, so that's what I think. All the points
And
you mentioned, yeah, there are many
yeah,
statutory compliances. So most of the hospitals would be obviously fire safe. They would be having a fire NOC, and I'm sure they would be. Only thing, maybe the pandemic has made them take a harder relook at these.
and before I let you go, what are the future expansion plans of Sahyadri hospitals? If you can shed some light on that.
Yeah, so we are currently the largest chain in Maharashtra. We are almost 900 bed at this point of time, and we aim to add around 3, 4, 500 beds. So we are on expansion spree, and you'll be hearing a lot from Sahyadri's point of view, and we will be talking about it as time comes on our expansion. But there is going to be a considerable expansion from year on, where we stand.
Right. Thank you so much, Mr. Abrarali, Dalal, CEO, Sahyadri Hospitals, for joining us today in the inaugural of second day of APAC India Digital Empowerment Meet and Awards. This day is completely focused on healthcare. And thank you so much for talking with us on building digital infrastructure for a better and connected healthcare system. But before I let you go, a small token of appreciation from our end to you. Can we have the certificate on screen, please? The certificate
So
of
much, Mr. Goswami. Yeah.
is
Thank you so
given
much,
to
Mr. Goswami. Thank you.
Dalal for dedicated efforts, exemplary work in healthcare. Thank you so much for joining us today.
Thank you
We
so
look
much.
forward to
Thank you.
interact with you in some other platform as well. Thank you so much. With this, we
Look
have come
forward.
to the end of this inaugural session.